All right. Hey, Krista, my name is Liam Maggar. Thank you for giving me this opportunity to speak with you about a policy that I prepared to pitch to you. So the policy that I'm speaking about has to do with alcohol sales, and it more specifically has to do with decreasing the amount of time that you're able to consume alcohol. So like making the time for last call earlier, pushing it back other than later. So just a little background. As we know, alcohol consumption can have a pretty profound effect on individuals' judgment and decision making. Uh, Alcohol has been associated with violent crimes and domestic violence across many nations. Um, More specifically, we're talking about Louisville, Kentucky. And currently, the alcohol can be sold from 6 a.m. in the morning to bars will close at 4 a.m. This is like the highest density of 4 a.m. bars in the nation. And compared to other cities close by, like Nashville and other places, it's a lot later. The problem is with spending or having these bars open to a very late hour, it gives people a bigger window of opportunity to make poor decisions and commit crimes that could be not that big of a deal of a crime, or it could be a violent crime having a profound impact on people. So a little bit of statistics that I prepared. The Louisville Metropolitan Police Department had 17,609 calls for service outside of these 4 a.m. alcohol distributing bars, meaning that even if they weren't coming for a violent crime, that's pulling resources away from the streets that violent crimes could be occurring. One of the big components of Louisville is the amount of homicides this year. So far, there's been 60 homicides in 2022. Over 50% have occurred between 8 a.m. or 8 p.m. and 8 a.m. So during the later hours. And altogether, about 40% have occurred on Saturday and Sundays. So that being the weekend where people are staying out later. So I'm proposing that they roll back that last call from 4 a.m. to 2 a.m., making it a smaller window for individuals to make poor decisions, causing whether it be a violent crime or pulling resources away from other parts of town that may really need some officers present.
Okay, thank you, Liam. Okay, again, I'm Krista Rudd, policy legislator. I knew we were meeting today and wanted to just go over a few details myself of what I found with your information. And again, thank you for all that information. But what I found is studies have shown that regulating retail availability of hours and days of alcohol sales show decrease in drinking problems, decrease in homicides, decrease in ED admissions, especially related to assaults. Local policies restricting hours that alcohol beverages are sold can be a means of reducing excessive alcohol consumption and related harms. Some statistics I've also found is excessive alcohol consumption equals 79,000 deaths per year. 15% of adults aged 18 and older binge drink, with 29% of high school students binge drinking. According to the Bureau of Justice Statistics in 2019, 36% of crime offenders had been drinking alcohol at the time of their offense. 2/3 of victims who suffer violence by an intimate partner reported alcohol had been a factor. 7 out of 10 alcohol-involved incidents of violence occurred after 1 a.m. Physical assault totals $5.8 billion in healthcare costs each year, with under or uncompensated costs to hospitals totaling $752 million per year. Louisville has increased the violence prevention capacity building from $5 to $19 million annually. And as you had mentioned before, retail locations sell liquor, beer, and wine from 6 a.m. to midnight, Monday through Saturday. and from 1 p.m. to 11:59 p.m. on Sundays, with locations able to get extended hour supplemental licenses from midnight to 4 a.m., with last call being at 4 a.m. Okay, so by reducing the hours alcohol is available in the community, billions could be saved in healthcare expenditure and violence would decrease. My concern is in 2021, Louisville Metro Councilwoman attempted to change last call from 4 a.m. to 2 a.m. and received much pushback, including a signed petition. Her goal was to decrease the violence in the city, and the pushback ended any possible change of alcohol sales hours. So what I feel is one thing that they're doing that I think would be good to continue is the funding of 3 more officers in Louisville's Alcohol and Beverage Licenses Office, focusing on late night enforcement. That will be at a cost of $370,000 to the city, but to offset that violence in the city, and to offer free training courses for bar and restaurant owners on best practices for public safety. And changing the alcohol sales hours, what I'm proposing, from 6 a.m. to midnight, Monday through Saturday, to 5 a.m. midnight, leaving Sunday 1 p.m. to 11:59 p.m., and extinguishing the extended hour supplement of midnight to 4 a.m. This will offset the high occurrence of alcohol-related issues at 1 a.m. And I understand where you're coming from. I can see that, but like I said, I'm concerned with this once being tried just last year, that we would probably just face the same issues.
Mm-hmm. So something to add to that is I looked at a study that was done in Australia that did a very similar thing, restricting hours of alcohol sales past 2 a.m. So they rolled it back from 4 a.m. to 2 a.m. and in some areas still opened it up till 3 a.m. And in the study, I read that the businesses had not been impacted by the changes and in some ways had improved. So therefore showing that the revenue was not decreased. They still had the same amount of people coming in, but consequently on a positive note, had a decrease in the amount of assaults, trips to the hospital in general, needing like ambulance and stuff of that manner. And another thing to kind of think about is with the sales and everything, you want it to be a safe area that would make you want to go out in general. If you're going out and you're scared because someone got shot nearby or right on one of the main strips, which for example, back in 2021, someone was shot dead right out in front of the 4 a.m. bar, which I've actually attended a few times. And that's horrifying to know that someone got killed right in front of my establishment. I could imagine
Sure.
to make a profound impact of people wanting to return to those main strips, downtown and everything, when their safety is considerably compromised.
Okay. So with the study that you saw, the 3 a.m. actually did not cause much change. So what I propose is that we bring everyone together and make a vote on a 3 a.m. change and see how that works. And basically, I feel as though I think we've accomplished a lot today as far as explaining what's going on. And I think that everybody in the community, all the stakeholders that are involved, can appreciate what we're trying to do here as far as the violence in the city is concerned. So again, I think we can put this up for a vote to change the time from 4 a.m. to 3 a.m.
Okay. I think that sounds like a good idea as well, and see if that does get implemented.
Okay.
What kind of statistics will be gathered from there?
Okay. And so to conclude, the need for change in alcohol sales hours to offset violence in the city has been proven. With negotiation, the policymaker and the policy legislator have agreed to terms that will satisfy stakeholders, and we can meet again, let's say in 6 months, to evaluate the changes made.
Sounds good to me.
Okay, that sounds good. Thank you for your time today.
Thanks for the opportunity of speaking with you. Thanks, Krista.
Thank you.
All right, bye now.
Bye.